Alright, so here's my video showing the room setup and everything else that's required for this test out. So you have the bed laying flat. I have the fluoro curtain on as well as the footboard. I would have like a pillow and some sheets and a box on the table. I just didn't want to waste them since I'm not actually doing a patient. So there is that. And then on back here, so we have just like the fluoro barium for when we're using the fluoro machine. I did pull up all of the different programs on here for double contrast, single, and then water soluble. So they're all in here. So then depending on which one we're actually doing, you just correspond when you have to do overheads, your correct program. For double contrast, you photo time 90 to 100 kV. Water soluble is 80 to 90, and then a single contrast is photo time to 100 to 125. I'm not sure if you wanted me to like click through and actually show you on here, so I just decided to state it and you'll let me know if it's wrong. As far as for how the procedure starts, I would do my verification of the patient. I would get a history of them, just asking questions such as constipation, diarrhea, generic question of just why they're coming in first. I would also make sure to ask them about any past surgeries, if they had like a colonoscopy or anything, to see if maybe we're checking for perforation, or any other procedure that they could have had done, which is why the reason we're doing this exam. I would also bring up the question if there's any history of cancer in the family, and then just maybe if there's any fever or vomiting going on. Just some generic questions on what brings them in for an enema study. As far as explanation of the procedure, I would have all my contrasts out. I would walk them through and kind of show them. I like to show my patients what I'm going to be using. So then once we are ready to start the exam, I'd have them get up on the table in like a Sims position. I would say I'm going to go ahead and insert the enema tip. It's just ask them to let me know if they're super uncomfortable at any point during the exam. I'll try and make it as comfortable as I can be, and then once the tip is inserted, we'll get the radiologist in here. We're going to inflate the little balloon to help keep the tip in, and then once the radiologist gives us the go ahead, we are going to start letting that contrast flow through the large colon. We'll be watching it move through the colon under fluoro. The rad might ask for some overhead pictures, so we'll do that as need be. And then once the rad is happy with everything, he will let us know when to turn the contrast off. And once everything is completely, I'll drain some of that contrast out. We'll remove the tip and then let the patient go to the bathroom right away to get any of that extra contrast out of their system. I usually would just explain it's a pretty simple procedure. It's not the most comfortable since we do have to stick a tip in the rectum. But again, I just always assure them that if they're any super uncomfortable, just to let me know, and I will make them as comfortable as I can for this exam. I think that's about it. If I missed anything, you'll just let me know.